Through innovation, academic excellence, and family-centered clinical care, Children's Mercy Kansas City is transforming outcomes for children around the world. Welcome to the audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So our topic today is interventional what? The image of interventional radiology. My guest is Dr. Brenton D. He is a pediatric radiologist with the Division of Radiology at Children's Mercy Kansas City. Dr. Redding, welcome to the show.
Glad to be here.
So why don't we just start off with, for all of our general practitioners out there, even some medical students, maybe some residents in family practice that are listening to this show, let's just start off with kind of how you define interventional radiology and maybe kind of contrast it to, say, general surgery.
Yeah, sure. So interventional radiology is a minimally invasive image-guided treatment of all sorts of medical conditions, some of which once required open surgery. And it uses advanced medical imaging, ultrasound, X-rays, CT scans, sometimes even MRI, and some other innovative methods to basically see inside the body and treat these complex conditions, and using catheters, needles, other things to access these areas in the body to do procedures.
So, from like a patient perspective, like, if you were to say, well, here's 3 reasons why you should choose, interventional radiology, what would be those things you would say?
So one of the advantages of interventional radiology is that it's minimally invasive, and so the recovery period after a treatment in comparison to a more invasive procedure is quicker and generally easier. One of the advantages that may not be immediately obvious to a patient would be decreased cost, because we do our procedures in a procedure room in the radiology area rather than in a more expensive OR suite up in the operating room. So those are kind of the 2 main advantages, that it's minimally invasive and that in general there's decreased cost because of the way the procedure is performed. One of the other advantages is oftentimes in interventional radiology, because of the way things are scheduled and the way things, it often takes less time to get a procedure scheduled in interventional radiology than it would up in the operating room.
And of course, again, from that patient perspective, when you say minimally invasive, that usually comes along with fewer complications, correct?
In general, yes. A lot of times the complications that we talk about with patients are similar to what would occur with an open surgery. But in general, yes, it does tend to decrease the severity or the number of complications that could occur during a procedure.
65% of patients are entirely unfamiliar with interventional radiology, with 54% of medical students unclear of IR duties. So what's going on there? Are we not teaching the medical students enough?
Yeah, I can remember when I was in medical school, I didn't have a good idea what radiology or interventional radiology was. Early on in medical school, we get exposed to internal medicine and surgery and a lot of those other more well-known specialties, and it wasn't until I was in my 4th year of medical school that I was actually able to do a rotation in radiology and ended up loving it. And so I think some of it may be that medical students just don't get exposed to radiology or interventional radiology as early as some of the other specialties.
Right. So let's talk specifically about some of the services that an interventional radiologist can perform or offer.
Sure. So at Children's Mercy, we provide all sorts of procedures, and it ranges from everything from vascular access, which is probably one of the most common things that we do. We also will drain abscesses, we'll perform lumbar punctures, and those are some of the more common, more basic procedures we do. But we also do more complicated procedures where we do angiography, sclerotherapy, percutaneous ablations, and things where we place catheters in to open up arteries that are blocked or to close arteries that might be bleeding and things like that.
So what's the future of interventional radiology? Are there any trends or, new ways to use IR that you see coming down in the future?
Right. So one of the things that we've been increasing at Children's Mercy is in treating cancer patients with percutaneous ablations or transarterial chemoembolizations, where we actually go into the tumor and will either heat up the tumor or freeze the tumor or administer embolic agents with chemotherapy in them to directly treat the tumor locally.
Yeah, and so that's going to be something. Now, is that more specific to what Children's Mercy is doing, or other centers around the country starting to use interventional radiology for those kind of cancer procedures?
So I think it is kind of a national trend, and it's something that has been used more frequently on the adult side for their oncologic patients, but is becoming more frequently used in pediatrics as well.
It's just last question here. What is so from maybe a medical student's perspective, or if there's like that fourth year medical student who might have an opportunity to take radiology as an elective that year, what would you like to say to that student? Or what's the career look like, or the overall need of interventional radiologists looks like for the future?
Sure. So over the 6 years that I've been practicing interventional radiology at Children's Mercy Hospital, our volume has increased every year. I think we're up 10 to 15% in volume from last year, just this year. So there's a steady increase in the number of procedures, the complexity of procedures, the things that we're able to do and are doing for patients in interventional radiology. So it's definitely an area where I think there's growth going forward. One of the concerns that some radiology residents have is telemedicine going to take over radiology, and if you're doing interventional radiology, you have to physically be there to do the procedure, and so that's an advantage in that aspect. And then, when medical students are looking at different areas, I would just encourage them to check out radiology and interventional radiology. I've found it an incredibly rewarding field, and it's a great way to practice medicine.
Nice. Thank you so much, Dr. Redding, for the work that you're doing at Children's Mercy and for giving us a nice little summary of interventional radiology. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.